Good morning. We're delighted to have you with us today, back with us for many of you, and new to us today for a few. Parents with us today, I think this is going to be a particularly engaging session for you. So without further delay, I'm happy to introduce Dr. April Fernando, who is an Associate Director at the Center for Innovation and Population Health and an Assistant Professor of Health, Behavior, and Society at the University of Kentucky's College of Public Health. Dr. Fernando works with nonprofit agencies as well as child welfare and behavioral health care systems, such as Idaho's, in implementing TCOM. TCOM stands for Transformational Collaborative Outcomes Management. And parents, if you are just over all the acronyms that we throw at you in the mental health world, I totally get it. In a little bit, I'm going to offer you a couple of websites and organizations to help you make sense of the acronyms in the youth mental health system of care in Idaho. So I'm going to say that again. TCOM stands for Transformational Collaborative Outcomes, and the CANs, management, and the CANs, which most of us learned yesterday or already knew, which stands for Child and Adolescent Needs and Strengths Assessment, is a TCOM tool. Okay, enough with the acronyms for now. Dr. Fernando is a licensed clinical psychologist who brings her years of experience as an educator, a clinician, and a mental health administrator to her work. Her session today is focused on assessment, the assessment and reassessment process. The process of seeking and receiving help for a child with behavioral health needs is difficult. Parents often feel blamed for their child's challenges, and children often feel angry, helpless, and at fault. Dr. Fernando's two-part workshop today looks at the assessment and reassessment process, defines its purpose, identifies barriers to a successful process, and provides strategies that will help parents and young people better navigate the process and have it be part of healing. That is the intention. The Child and Adolescent Needs and Strengths, or the CANs, as an integral part of the assessment and reassessment processes will also be described, and its role in family engagement and empowerment in the journey through behavioral health care will be discussed. Dr. Fernando, welcome. Thank you for being here, and I will hand things over to you.
Thanks so much, Ruth. I'm going to share my screen and hopefully it will be all okay. Oops, there we go.
Yeah.
Does that work?
Looking good.
All right. So thank you so much. And I want to thank Ruth, the Idaho Federation of Families. I want to thank all of you for your time today, for taking the time out. I'm also going to thank you ahead of time for your participation and your questions and your thoughts and thinking as we talk together. It's really weird to have a conference virtually. I do this all the time because we do a lot of training and teaching, and it never gets any easier or doesn't feel weird. It always feels weird. One of the things I was telling Ruth earlier, one of the things I like to do as we start is I like to, in a conference, is I like to get to know people at the conference, and we don't get that opportunity so much today. So I thought I would jumpstart this experience by sharing an introduction of myself that tends to be a little bit more personal than typical. So this is a picture of myself and my family at my son's first year of college at his family and friends weekend. And if the picture looks a little weird, it's because I didn't take the picture. Someone didn't take the picture and give it to me. This was taken off a poster that the university put up talking about the diversity of their families. So apparently we gave them permission to do so. So I'm sharing it with you. And just to help you understand who I am a little bit better so that you can understand where my comments are coming from. I am an associate director at the Center for Innovation and Population Health at the University of Kentucky. I'm actually talking to you from Chicago, so I don't live in Kentucky, I live in Chicago. And I am a child and adolescent clinical psychologist. I spent my first 25 years of my career as a therapist, sitting in an office, working with kids and families, not so different from you all, and trying to help them find ways to, better support their children and help their children have fruitful and productive and enjoyable childhoods and lives. And I also ran a mental health clinic for many years in California. And that clinic saw children, a lot of children in foster care, a lot of Medicaid children. And towards the end of my career as a clinician, I did have a very small private practice for kids who were leaving our clinic who wanted to be seen at a very low fee. So my heart is as a clinician, so you'll hear that in my conversation. Also wanted you to know that I am a daughter of some great parents who are still alive, who immigrated to this country. And my sister is here, you can see her. My brother is not in the picture. And I have a son, he's the one that looks disgruntled in the picture, who is now 22, who, like many of you, my son had neurodevelopmental diagnoses. He struggled with very severe dyslexia. He was diagnosed with ADD. He had lots of executive functioning issues and had a really hard time with math because he didn't have very good working memory. So those of you with kids with neurodevelopmental issues know exactly what I'm talking about. And he allows me to share this story because he, with a lot of help, has figured out a way to make it work. His brain, as he says, his brain finally caught up with him, and he's finishing his junior year in college. So, that's a journey I can tell you about another time. But that's who I am, and hopefully that will help you understand where I'm coming from today. All right. So today we're going to talk, at least this first part, we're going to talk about the purpose and process and the pain points around assessment. We're going to talk about the role of the CANs in the assessment process, and we're going to end our session today. It might this morning, and it might roll over into our next session about making assessments productive. I want to start by launching a poll and having you tell me a little bit about your assessment experience. So here's the first poll I'm going to launch to you all. So if you wouldn't mind answering the question, it'd be super helpful just to help me get a sense of where we are, what your experience has been and where we are today. Got about 40% of you participating. I'm gonna leave it open just a half a minute longer just to see who else might want to share their experience of assessment.
April, I'll tell you that we do have more people attending than have answered, but not everybody attending will have an answer for this or will be a parent.
Okay, no worries. Thank you. All right, I'm going to end the poll. So if you're waiting to hit that button, you have 3, 2, 1, here we go. And I'm going to share the results. We do have a majority of folks who haven't experienced an assessment, but for those of you who have, most of you had an okay experience. Someone had a bad experience, and someone actually had a couple had a good experience. So that's helpful. Thank you so much. Okay, I've got one more poll for you to answer. before we get going here. So here's the next question. What was the process of care? Was that process of care explained to you by your assessor when you were going through your assessment process? I'll give you guys just 30 more seconds and then we will stop the poll and we'll see what your responses were like. All right, I think everyone who's responded will. So let me end the poll and let me share the results. So again, we have a lot of folks who didn't go through an assessment, but unlike the previous one, a lot of people had a bad experience with this particular part of the assessment process, right? We had one person who had an okay experience. All right, well, that's really helpful to me to understand what your experience is. I'm gonna ask you more questions in just a little bit, but this is enough to get us going right now. So we're gonna start with talking about the purpose of the assessment. I do wanna have one disclaimer as I begin. I know that we're gonna be talking about an assessment process to receive general mental health services. I know that sometimes some of you have your children have gone through psychological testing, which is sometimes called an assessment. And I don't want you to get confused between the two. I'm not going to be talking about psychological testing, which is something I've spent many years doing psychological testing myself, which is when we're trying to typically understand a diagnosis better, or when cases are stuck and they're very complex, sometimes psychological testing can be helpful. There are aspects of what I'm going to be talking about that overlap with psych testing, but I'm not specifically going to be addressing psychological testing today. If you have questions, I'm happy to answer them through the Whova Q&A, or you can contact me and we can chat, but I just wanted to make that disclaimer. All right. So assessment, why do we need an assessment in order to get services, right? Mental health services. So here's kind of three broad reasons that we need an assessment, right? Sometimes the assessment process helps everybody involved gain an understanding, share their perspectives and gain an understanding of what's really going on. And what we're trying to understand are what are the challenges that your child and you are facing, and what are the supports that are in place, okay? Now, what might be surprising to some of you, or maybe not because this happened to you, when I've done assessments with families, sometimes surprises are revealed in an assessment setting. It's not unusual, for example, for a child to say something that you didn't know about, for your child to say something like, you know, sometimes I skip class maybe once a week and I go smoke weed with my friends. And you look at your child and you're like, what the heck? Like, I didn't know that, right? Or they might say something like, I think about killing myself almost every day, and you had no idea, right? Because sometimes the impact of their thinking, this kind of thinking or these behaviors hasn't revealed itself yet in terms of other parts of their life, right? So it's good sometimes to talk about things with when there's someone sort of guiding the process, because it reveals some things that you may not have known. An assessment also is supposed to highlight the context in which the challenges that brought you into seeking help. What is that context, right? What have you tried before that has worked? and why is it not working now, right? This is going to help us also understand how best to approach supporting you in addressing the challenges, right? As families, we're always making adjustments and adapting to whatever comes our way, right? Children grow and change every day. Our family circumstances grow and change every day. Sometimes we don't even know that what we're dealing with is unusual or something that not every family deals with, right? So when we talk about changes and how you cope, it's not because we're trying to find out what you're doing wrong. It's because we're just trying to find out, how is it that families cope? How has your particular family coped? What's worked and what hasn't? And finally, the reason we do an assessment is because it guides that process of care, right? It helps us understand what's going on and what we have available to us that might be helpful to you and your family. And I said that in a particular way because sometimes we don't have the full array of potential services that could help your child available to us. So we need to understand what's going on, what do we have available, and try to match that as best we can, right? The information that is shared and asked about in assessment helps determine, as you heard from Dr. Israel yesterday, diagnosis. It helps determine level of care, and it also helps us understand how to specifically put that treatment plan together. Okay, so what is it that goes into an assessment? Okay, what are the things that could happen in an assessment, for example? Okay, one of the obvious things are interviews. Okay, you might be interviewed as a family. You might also be given an opportunity to be interviewed as individuals, right? As mom, dad, other caregivers. Depending on how old your child is, there also probably be an opportunity for your child to talk alone with the assessor, right? What we're trying to understand as assessors are first of all, what are the circumstances that brought you in? What are the challenges you're facing? And then we want to understand in a broad way what's happening with your child, their health, their educational progress, and how they're functioning in different aspects of their lives. Because this will help us really understand the impact of the challenges and how and maybe what intensity of services could be helpful to them. You might be given checklists and questionnaires to fill out. Okay, hopefully you're not handed a cans to fill out. I'll talk more about that in a second. But sometimes you're given checklists and questionnaires, right? You might be given a trauma symptom checklist or something about just what behaviors have you seen in your child lately. Sometimes questionnaires are given to young people to answer when they're old enough. Sometimes they're just given to parents. Sometimes questionnaires are given to teachers or other important people, which gets us into the other section of checking in with other important people. Okay, children are supported by a lot of people in their lives, right? School-age children, at least pre-COVID, spent a lot of time in school, right? Right now, some of your kids may be in hybrid situations. Hopefully, in Idaho, kids are back in school, but they spend a lot of time in school. And so we need to understand what's happening in those environments when we as parents aren't around. So the assessor might want to talk to school personnel if they're involved in sports, their coaches, if you are active in church, some of the church folks that work with your child, if they're in piano. So the other people that are involved, extended family, they'll want to really understand a full picture of what's going on with your child. And if they're involved with other professionals, right? Their primary care physician, their pediatrician, if they're involved in other types of professional services. And finally, in Idaho, right, the assessment involves the CANs. And the CANs will help to organize this information. I'm going to go into depth about the CANs in a few slides down the road, but I just wanted to give a kind of a broad sense of what goes into an assessment and why it's so extensive. Okay, so now I want to get more feedback from you all. So if you wouldn't mind answering this question in the chat. So go into the chat feature, which is at the bottom of your screen, and answer this question. What gets in the way, or what has gotten in the way of you having a good assessment experience or your child having a good assessment experience? So I'm going to give you all a little bit of time to answer that.
Dr. Fernando, I'll let you know when we have some comments here.
Okay.
Okay, child doesn't want to talk to a stranger about their behavior.
Absolutely. Who would?
Okay, we have a lot of you out there. I hope you'll give us some feedback here. 5 grandkids we are now parents to permanently that have a lot of baggage, trauma, and genetic issues. There is secondary trauma, and especially doing it 5 times at 3 hours each is a lot.
Absolutely.
Yeah, so the secondary trauma isn't actually doing the cans.
Yes. I completely agree. I once had a young person tell me how weird my job was because all I hear is about bad stuff kids do all day long. Right? Multiple
Another
cans
comment.
assessments.
Yeah.
Yeah. Go ahead, Ruth.
Sorry, multiple cans assessments and repeating info.
Mm-hmm.
Very frustrating.
Yep. Very frustrating. Anything else?
It's like oh, there we go. Our assessments have been good, but have not resulted in any helpful services. So
That's a bummer.
Yeah.
That's a bummer. So here's another comment.
Exactly what you said earlier. Teen just now able to articulate symptoms.
Right. The secondary trauma is doing the cans. All right. I hear you loud and clear. And I am so sorry about that, right? Talking about my child in front of my child. He hates that. I don't blame him. Mine did too. Mine did too. Last call for some comments. Ooh, here's a good one. One time there was a language barrier. This assessor had a strong accent that kind of assessments. I'm sorry, I can't read that first sentence. My son has had 2 psychological tests where we lived in Florida, but I'm wondering about developmental assessment to see what age he really is operating at. But what is that called? It's exactly what you just called it, a developmental assessment. Is that different from the assessments we're talking about, right? Yes. So a developmental assessment and a psychological testing or psychological assessment or psychological evaluation, those are different. Those are very specific types of testing situations. So I'm not necessarily talking about that. I'm talking more generally about the assessments that happen when you're trying to get into just general mental health services. All right, you guys can keep adding things to this chat as you think of them or want to share. And Ruth can tell me when you've shared something. I'm going to move forward just to talk more about, just to move forward in my talk. So yesterday, Dr. Israel laid out very beautifully, he primed the pump for me, so to speak, about what happens, right, when we have a good assessment and how that can result in a really good plan. So one way to think about what happens after an assessment is that we start to develop a theory of how change will happen for your child. Okay, so here's in very broad brush strokes what happens with a completed assessment, right? The completed assessment helps us know where we are and what's happening. Hopefully, everyone who's involved is on the same page of knowing where we are and what's happening. Okay, then we hopefully will develop a shared understanding from knowing what's happening as to where support could be helpful for your child and your family, and how we're going to go about doing that, right? We're going to develop goals that represent the change we want to see happening, which is, part of Dr. Israel's treatment pyramid. Okay. And then for all of those goals, we have to develop those action steps. We have to identify interventions. And as he mentioned yesterday, as Dr. Israel mentioned yesterday, we have to make sure we're developing strengths as well as accessing the strengths that your child and your family have. So this is the theory of how change can happen with your family. It needs to be personalized and customized and developed just for your child and what's happening with them. I want to focus a little bit on these two sections right here. What goes on between a completed assessment, right? And getting to that shared understanding, because something happens there. It doesn't happen magically. Okay, so what's supposed to happen there? What's supposed to happen here is the information that the assessor has gathered about your child should be brought back in and shared with you so that you know everything that's been gathered. Right? And hopefully it won't be a surprise to you. But there may be some aspects that are surprising, right? Because the assessor, you, and if they're old enough, your child to understand, your child should all understand what is going on, right? Here's everything. Here's how my anger, if I'm a young person who's angry, here's how my anger impacts school, impacts my sports, impacts everything I do, right? We need to get that kind of 360 view of what's going on, right? The assessment information then is going to inform, right, what we're identifying as needs and strengths, AKA the cans. It's going to, like, once we complete the cans, it's going to then help us understand that level of care, right? What the recommendation is for the level of care. All that assessment information also helps us understand a diagnosis, right? Which is really important in order for us to understand how we're going to approach providing support or providing care. The other thing the assessment information does, and this might be a different way of thinking about it, is determining clinical focus, right? Are we addressing why something is happening, right? The underlying issues versus we know why and we're addressing what? We're trying to understand how do we maintain, right, good functioning for example, kids who have are on the autism spectrum, who have developmental delays, right? We know some things won't change for some individuals or some young people, but we can always try to help maintain gains and move them forward in their functioning. So are we looking at the why or are we looking at the what? Okay, this is what's going to help us get to that shared understanding and have some consensus on what are we going to focus on and how are we going to get the help we need. Okay, that's what should happen. It shouldn't be a magical process between the assessment being done and then all of a sudden you have a plan. This should be something that you as a parent are included and engaged in participation to develop, to understand what's going on, take the information, and then determine how to move forward. That's a big part of the steps to understanding the process of care, which was my first polling question. Let me stop there and see if there are any comments or questions.
There were a couple more comments back related to your last question. We had
Sure.
one comment that said, when your assessor isn't the friendliest and your child already has trauma from seeing so many doctors, your child won't talk.
Yep.
And not having all the documents or the ability to get the documents,
Yes.
the child doesn't want to talk. And if your assessor isn't nice, again, it's challenging. And knowing how to get the documents.
Knowing how to get the documents. Yeah, that can be really hard. So thank you, Ruth, for sharing those. And thank you for writing those in. You know, one of the things I didn't tell you that I did in my previous things I did in my career was I was a training director for psychologists. I actually trained psychologists, child psychologists and adolescent psychologists to become psychologists. And I'll tell you a secret, you know, a lot of child and adolescent psychologists become child and adolescent psychologists because they think they don't like adults. And so, which is ridiculous, right? Because when you work with kids, you'll work with families. It's like the two go together like hand in glove. And so being nice to the adults in the child's life is one of the first things that I always used to work on with my interns, because they just kind of want to get through the adults so that they can start seeing the kids. So I understand that struggle. And it is definitely a training issue, which is why Dr. Israel's comment yesterday about get to know the supervisor is really important, right? It's really important. All right. I'm going to talk now about the CANs. And I realize that for many of you, this is going to be a review. I hope that there's something new you can learn from hearing and understanding the CANs. I know for myself, I don't think I've learned everything I need to know about the CANs, and this is my full-time job, and I've been doing it for many years. So before we get started, I've got my last poll to share with you, if I can get my cursor to work here. All right, here's the last poll for today, for this morning. Couple more seconds and I'll shut down the poll. I just realized that another polling question I should have asked is what your experience was in general with the CANs, because it sounds like there were some pretty negative experiences with the CANs. All right, I'm going to shut the poll down and share the results here. All right, so most people didn't have the CANs explained to them or shared with them, and that might be because they didn't go through an assessment process. I know that sometimes it's a struggle to get the CANs from your providers. Again, not sure why, because the CANs is basically your story. It's yours. They should share it with you. It seems like one person had a good experience with this, and some people had an okay experience with that. Ruth, I'm wondering if there's some comments. I'm seeing the chat might have.
Sorry. Okay. Yes.
Go for it.
Well, and this is something that I thought of yesterday, and should have queued people up for this. It's a little challenging how to figure out how to answer when you've had multiple CANs experience in your family with different children, and they were different types of experience. So some people are struggling a little bit with that.
Okay.
We have a comment. My child's assessment was done in January, wasn't available to me until April.
Wow.
was not explained or shared with me or his case manager. We are still without services. Super frustrating.
Yeah, super.
Another comment, we went through the complete process, hours and hours and even days of it, but it was never explained, just told we still qualify via a letter. Wow. And then another, never received my CANS report.
Yeah, I'm so sorry. That's so not acceptable. And Dr. Israel laid out the reasons why it's not acceptable yesterday when he was talking about policy and what the expectation is. And to put it in plain language, right? The assessment information that you are providing to however many providers you talk to, that's your story. That's yours. So to ask for a copy of how they documented your story seems like a no-brainer, but that's what you're doing. You're saying, hey, I just told you my story. You wrote it down. Can I have it back? That's what you're asking for. So you should be able to get it. And it's helpful if you get it, right? Because the more information you have and you're participating in doing something with the information, the better off you and your child are going to be, right? What can we do with the CANS? What's it good for, right? Here
Dr.
are the
Fernando?
things. Yeah, go ahead.
I'm sorry, I'm going to share one more comment because I think
Sure.
it's important. I'm sorry I popped on video, I didn't mean to.
Okay.
But we have a comment that, and this is the power of this session and this conference and what you're offering us, that someone just figured out from this event to look and see what level their son is. They never heard about wraparound or heard the words, or they did hear the words but didn't realize that this whole, how it all fits together. And they have a son who is a level 3.
Yes, which is wraparound.
Yeah, and then a final comment, how important it is from a parent, how important it is to get the document to make sure that they and review it to make sure that it really looks like it's an accurate reflection.
Absolutely. And this is why I'm going to take the time to talk about the CANS, because I know that the CANS gets blamed for a lot of things, and that's okay. I'm not the CANS, I don't mind, but I think maybe we need to help you understand how the CANS shouldn't be done to you, right? The CANS is something you participate in so that your story can be told as clearly as possible, right? Here are the things that the CANS is good for. It can help us understand eligibility for specific services and supports. That's the level of care. I'm going to talk to you about how the level of care is determined a little bit later. The CANS helps organize information from a variety of sources, right? That helps us identify priorities for treatment. It ensures family participation. If the CANS is being done in the way that it was intended, family participation is a central piece to the CANS. And I don't mean families being tortured with questions. Okay, I'll talk more about what this might look like. The CANS is supposed to help maintain coordination between providers, right? I know that some of you participate in a committee called One CANS, One Child, okay? There's supposed to be one coordinated CANS for every child in the state of Idaho, regardless of how many services they're engaged in at any one time. And it's critical, and I'm going to talk about why that's critical. And it's supposed to identify ways that you have met your goals to help you celebrate successes, which we do not do enough as mental health providers, right? So how does the CANS do this? Well, let's start by, at the beginning, just reminding us all what the CANS is. Okay, the CANS is not the discovery process. I'll say that again. It's not the discovery process. If someone takes the CANS, goes down the list of items and starts asking you questions, they're not doing it correctly. Okay, the CANS is meant to be the summary of the assessment process, the summary of the information. It takes all the information that was gathered through interviews, through, all those things I mentioned earlier, brings them together, summarizes them in one tool that everyone can understand what it means. Okay. One of the core aspects of the CANS is it's meant to be a communication. It's meant to be a language and help with communication. Okay. So we want assessors to introduce the CANS to all of you, tell you what it is, tell you how it works, talk about the action levels so that we can communicate together in a common language. Okay, it brings together information from all aspects of the assessment and organizes them in the items of the CANS and in the domains or in groups of items. It also brings together all the voices, your voice, your child's voice, all the important people who have been part of the assessment together and summarizes that in the ratings of the CANS. That's the intention of it. Okay, Ruth, I'm going to stop to see if there are comments or questions.
Let's see.
Oops.
We're having, what's great is we're having some parents ask questions and other parents are able to help.
Okay, that's cool.
Answer some of them.
Yeah.
I'm also going to say for people who have individual situations where you're not getting to the help you need and deserve, then please touch base with the Federation after the conference through our family support line, which is on our website. And we would love to just make sure that we connect you with everything we know to connect you with and advise you on your individual situation.
Perfect. All right. I'm going to keep moving forward. So Ruth talked a little bit about TCOM, Transformational Collaborative Outcomes Management. This is the theory that underlies the CANS. I'm not going to talk about the theory itself. I'm going to talk to you about the values that underlie the theory. Okay, here are the values that underlie the theory. These are the values that underlie the CANS, essentially. And it's important for you to understand that these are the values, because values, as you know, our values show up in our behavior. Our values show up in how we talk. Our values show up in how we interact with each other. The values of the CANS should show up in the way that it is used, right? All assessments and interventions should be culturally responsive and respectful. That means that assessors need to understand who you are as multicultural individuals, right? Not everyone's the same. We're all human, that is true. But we are different flavors of being human because of the circumstances that brought us to who we are today, right? I mentioned earlier on purpose that my parents immigrated to this country. Their immigrant experience is very central to who I am and how I was raised. And that needs to be brought into an assessment about me. And we need to be respectful of people's differences, and that needs to be reflected in the CANS. Okay, people should have voice and choice with regard to participating in assessments and in interventions. Again, we're working with you to help identify how we can support you. We're not forcing you to do things because we think that they're the best thing to do, right? This is a consensus collaborative process. Intervention should be personalized, respectful, and have demonstrable value to the people they serve, right? There are things called evidence-based practices. I'm a psychologist. I had to know all of these evidence-based practices. I'm also a psychologist who worked primarily with kids in foster care. Okay, when they do these large evidence-based practice studies, kids in foster care oftentimes are considered outliers in those studies because they have so much trauma that they don't respond in the same way, right? So what this tells me, I'm not saying evidence-based practices aren't good. It's the opposite. I'm saying evidence-based practices help us understand the floor of what is best practice. but we always need to consider the individual when we're trying to find the best way to work with them, right? So let's start with the evidence-based practice, but let's consider the uniqueness of your child and your situation. Collaborative processes inclusive of children and families should be used for all decision at all levels of the system, right? So it's not just about, was your child ever hospitalized for psychiatric purposes, and that's going to doom your child for the rest of their life. They're going to use it as a predictor for everything going forward. That's not the way we think about the CANs. That's not how we set up the level of care based on the CANs, right? Consensus on action is the primary outcome of a collaborative process. In other words, if collaboration is going well, it means we're building consensus. And I'll talk more about that in the next slide. And finally, the information about the people served and their personal change should always inform decision-making at all levels of the system. I'll give you a great example of this. In Illinois, we did John Lyons, the developer of the tool, his team did a study in Illinois years ago that showed that, and it's a kind of a no duh, you guys are going to say no duh, April. They showed that the best outcomes for kids was when the distance between the door of their home to the place they were receiving services was shortest. The shorter the distance, the better the outcome. Well, no duh, right? But this helped Illinois move their services around so they were closer to where kids needed them. Okay, so rather than having a third office in Chicago, right? Let's put it out somewhere out in central Illinois where they need more support. All right. So in the CANs, it's really important that we build consensus. And to build consensus, we need participation, right? So consensus is the primary outcome of a collaborative process. That's not just a value, but it's a critical practice when the CANs is in play. Unlike many other tools in mental health, the CANs is a consensus-based tool, okay? So in this little graphic here, we've got our client here. Here's client's parents. Here are some professionals. Here are the client's records. And here are all the other important people in the client's life, in this young person's life, that we need the CANs to represent all these perspectives, right? The ratings shouldn't be the perspective of the assessor. They should be in consensus with what you think is going on. Okay, which means there might be times where you need to talk through when you have differences of opinion on what's going on. Okay, which, you know, as an adolescent psychologist was really fun, right? Like, you know, adolescents sometimes go against what their parents say just because that's their job, which is true, that's their job, right? But when we can find a way to talk about, well, you know what, you're pot smoking, sorry, you're weed smoking. I hear if you say the word pot, it indicates that you're a boomer and you're out of it. Your weed smoking is actually impacting your functioning, right? It's impacting your friendships, your relationships with your family. If we can focus on that rather than the fact that smoking weed is against the law, we might be able to come to consensus. And that's the job of a professional to help that conversation happen. Okay, what makes the CANs accurate and reliable? Meaning, what makes the CANs tell the real story of what's happening with the young person and their family is the input of the young person and their family to the ratings. So what is it that we're trying to get consensus on? Needs and strengths, right? It's in the title of the tool. And I wanted you to see the definition of what needs and strengths are for the CANs, right? Needs means it's a characteristic of your child in an environment where they could benefit from external support, meaning that they can't do it on their own. They could benefit from external support. Now you notice it says an individual in an environment. That means that if your child has a need that shows up only at school, it's still a valid need. Because if that need is impacting their ability to progress academically, they need support. Or if that need only shows up at home, it's still a need, right? Because it might be impacting their relationships with you, their relationships with their siblings, their ability to be part of the family and progress and grow. So they need support around that. So just because it doesn't show up in every environment doesn't mean it's not a need. Okay. And needs that benefit from external support are what we want to focus on, because we all have needs. If you can take care of your own needs, great, take care of your own needs. It's where you could benefit from external support. So it's not a judgment. It's kind of like, hey, let's figure out together where help could be useful to you. Strengths are also characteristics of individuals. They're also things outside of people, right? So outside of your child, they could have an external strength. That's what Dr. Israel called internal assets versus external assets, right? And these assets provide your child meaning and well-being, not just meaning, right? But well-being as well. So these are the things we're trying to understand in the CANs. Okay, so we have this rating scale of 0, 1, 2, 3. Personally, when I work with families around with the CANs, I don't talk about numbers. Okay, after a while, when everyone's comfortable with the CANs, we start talking numbers because it's shorthand. But when I first introduced the CANs to kids and families I'm working with, I don't talk about the numbers because it makes people feel judged, like I'm grading you, right? Like it's like the Olympics. You do your thing and I give you a grade. That's not the intent of it. The intent of it is to help us communicate. So I actually talk about what the numbers mean more than I talk about the numbers when I'm working with individual kids and families. So needs, we're going to monitor and address needs, right? 0 means there's not a current need. We just don't have to do anything about it. Could that change tomorrow? Maybe, but we're going to deal with it tomorrow, not today. 1 means let's just watch and prevent it from getting worse, right? So this might have been a need in the past that we want to keep an eye on, or the need's happening right now, but it's not impacting functioning of the child, of your child. Okay, this is where you might not agree, but if it's not impacting functioning, then let's monitor it. Okay, and let's help you figure out what we need to monitor so that you know exactly when it starts to become a 2, right? The need starts to impact your child's functioning or people around them. Okay, a 3 is help is needed urgently or intensively. Urgently meaning hospital, intensively meaning something like wraparound, right? Because the need is dangerous or disabling to them. Those are the needs. These tend to be easy. The strengths, right? A 3, I'm going to start with a 3. A 3 means we haven't even identified the strength. It's not that they don't have strengths. We just haven't identified them. Strengths require opportunities for us to build them. So if you've never had the opportunity to build a strength, you might not even know you have it. Okay, so a 3 means we just need to identify it, then we can start to build it. Okay, a 2 means we might have identified it, but we've never ever built it. So let's put some effort into developing it. A 1 means a strength that's probably been there, it's been developed, but it's not used a lot. So we might need to support the use of that strength to make it stronger. And a 0 is a strength that's always used. It's there, it's available, it's used a lot.
Dr. Fernando, can I interject a comment?
Sure.
It's actually a question too. Does the CANs take into account the parent and family's needs and strengths?
Absolutely.
This also affects the child.
Absolutely. And I'm going to talk exactly about that on our next slide.
Great segue.
Yeah, thank you for that prompt. Last thing on this slide, okay, the 2s and 3s, we talk about these as actionable items because we're either going to address this if it's a need or develop it or build it if it's a strength. Okay, so when I work with little kids, we usually come up with little emojis to represent the 0, 1, 2, 3, because it helps me communicate with them and helps them reflect on what's happening, and they can participate, right, in understanding if things are changing or not. So we come up with little emojis. If that's helpful to you, go for it. You know, with adolescents, we tend to come up with swear words that reflect the different levels. We tend not to share that with families, with their parents, but that's what we do because it helps them stay engaged. So there's ways to engage everyone in the family to help understand this. My son today will tell me if, you know, what's going on. He'll say, Mom, it's just a 1, just chill out, right? Or he'll say, okay, it's a 2, and let's talk about, you know, I'll call you, let's figure it out. It's shorthand now for us, right? So it's meant to help you. It's not meant to label or criticize you. So I just want you to get comfortable with it so that you know how to use this. And in sessions, in assessments, we should be talking about what the numbers mean, not the numbers themselves, what they mean about your child. All right, what's in the cans? Just a quick reminder of what's in here. We do want to understand if there's been any trauma that has been experienced by your child. We don't need to ask questions. If we have something that tells us they've had trauma exposures, great, we'll take that. And we'll just verify it somehow, okay? Strengths, what are those strengths that they have, and what are, you know, have they had opportunity to develop strengths, and where are they? What's going on in their life, right? How are they functioning in different areas of their life, school, relationships? Are there any specific cultural needs, language, you know, and culture could be religious background. It doesn't have to be ethnicity, right? It could be, I grew up in a very religious family. And so, you know, when we would travel, we would pray before we had a meal, right? No matter where we were. And sometimes we'd get harassed by people, right? That's a cultural need, right? Behavioral emotional needs, those are your stereotypic mental health needs, right? And as Dr. Israel said yesterday, the CANS is not a diagnostic tool, but it's consistent with descriptions of diagnoses, and so therefore can be helpful. And we also assess risk behaviors, these things that could potentially hurt your child or others around them. And we do take into consideration caregiver resources and needs. And what's interesting about the CANS is we understand the CANS factors in the fact that as parents, we're different parents to different children. If you have multiple children, you're a different parent to each one of those children. It has nothing to do with you wanting to be fair. So I want to take it out of that kind of thinking. It has to do with different kids of yours need different things of you as a parent. And sometimes you're good at those things, and sometimes you need support around those things. So just think about it, just general, that's how it is as parents. Now, if you've got children with special needs, right, and they might not, those needs they have may not match with your super strengths, then you might need some support. So that's how the CANS takes it into account. Again, it's not a judgment on you as a parent. It's just identifying where you could use some support in parenting this particular child. So let me pause there, see if that answered the question that was asked previously.
Let's have anybody type in the chat if they, yes. First of all, we have a yes that it did answer the question, and people know you can keep typing questions into the chat as you need to.
Awesome. Okay. All right, one more slide on the CANS, and it's about level of care. So the level of care is we call it a decision support model. We don't call it an algorithm anymore, and I'll tell you why. It's a decision support model actually describes what it is a whole lot better. Algorithms that term has been ruined by Facebook and Google and Amazon and all the folks that use models to track our behavior and predict what we want to purchase. So we don't use the term algorithm anymore. Decision support model is actually more descriptive. It's more true to what it is. So the level of care is a decision support model. What it does is it takes criteria that we know clinicians use, not just in Idaho, but also in our field. We know that here's how clinicians make decisions about certain things. We just want to make sure those criteria are applied consistently and reliably. So the CANS actually filters in to the level of care decision support model. So the way it's built is, first, it takes into account life functioning needs across every one of your 3 levels. So level 1 is outpatient, level 2 is child and family teaming, and level 3 is intensive case or care coordination, right, or wraparound. So the basis to become eligible for any of those levels first starts with having some functional needs. Now, the different levels will have different requirement of functional needs. Then what we do is we take the complexity of your child's presentation, behavioral emotional needs, risk behaviors, and in some cases, if caregivers need support, factor into how the levels fall out and how your child can be eligible for the different levels, right? The more complex a young person's needs are, the more intensive this recommendation will be for services. All right, so let's see. There's some notes here I wanted to catch up on and I didn't keep track of it, right? So it's really important, right, to remember that the level of care identifies the intensity of care that best supports your child's needs as depicted on the CANS, which hopefully helps you hear that what I'm saying is get involved in how that CANS is put together, the ratings on that CANS, because it's going to impact level of care and hopefully impact the treatment plan also. Okay, so we want the CANS to really represent the story of your child and your family. Now, the other thing I want to say about level of care, right? We have designed them hopefully so that we can best match the level of care to your child's needs. Higher does not necessarily mean better care for your child, right? It's about the match between your child and the child's needs and the level of care, not how high can you get to. We know from research that we've done with our particular levels of care that when children are placed in lower levels of care than they actually need, they don't do as well. I mean, that's kind of obvious, right? If you have certain needs and you're placed in a lower level, then yeah, you probably won't get the most that you need. But what may be surprising to you is when there's a level of care recommendation, but children are placed in a higher level of care. So in other words, if the level of care recommendation for your child was a 2, right, child and family teaming, but they were placed in intensive care coordination wraparound level 3, what we found in our research is the outcomes are not as good either. It's not as bad as putting them in a lower level of care, but it's not as good as putting them in the right level of care. So higher does not mean better, right? We want kids and families to receive the care that they need based on what we understand of their needs. Let me pause there and see if there are any questions or comments.
I don't think we have any new questions.
Okay.
Keep an eye if anybody pops one in.
Excellent. All right, so how can we make assessments more productive? Right? You understand the goal of them. I hope you understand better how important the cans is and how important it is that you stay engaged and participate in that process. I'm going to talk a little bit about how we can make assessments better. And then later on in our second session, I'll talk about how to make that reassessment better. And we'll revisit some of these things we've talked about this morning. All right. First of all, and some of these may be obvious to you, take time to prepare. Many people have already mentioned how traumatic assessments can be. Okay, telling your story is traumatic. Telling your story more than one time is re-traumatizing, right? Not just for your child, but for you. Okay, so it's important to take time to prepare. It's hard as a person who's done assessments, it's hard not to understand the traumatic aspects of your story. Those aspects are important for us to understand. It's on us, however, to make sure that we have you tell us those pieces in a way that is supportive and doesn't re-traumatize you. Okay, so taking time to prepare is really important. Think about what's easy for you to share. And also think about what makes you feel more vulnerable and emotional when you try to share it. Because as a psychologist, I don't want you to push yourself to share something that later on, after you leave my office, makes you fall apart. That's not okay, right? I want you to share what you can share. If we need to come back and talk later because now you're ready to share more, that's fine, right? So take some time to prepare. What can you say in front of your child, or what can't you? And it's okay to not share everything in front of your child, nor should we ask you to. And if you're a young person, right, what can you share in front of your parent or your caregiver, and what don't you want to share? That's okay too. If you can't tell parts of the story that are important, let's figure out who can share that part of the story. If it's written down, let's try to share that if we can get a hold of it, right? If it's another person who's holding that story, let's try to make sure that they can find a way to share that with the assessor. And also take time to identify signals to indicate when you need a break or you need some support. It's okay to take breaks. Again, I know it feels like if you don't do this right, you're not going to get help, right? But if you get traumatized in the process, that's not helpful either. So this is supposed to be a collaborative process, remember? So if you need to take a break, it's okay to take a break, and you can ask to take a break. All right. So that's the first thing I want to say. Take the time to really prepare yourself and your young person. There's a tool that you have that could help you, right? The Yes Family Workbook is really helpful. The first 6 pages, I think, are very focused on helping you prepare for assessment. I would take some time if you're going to do this to fill this out. And you don't have to write you can just write notes, you can write an outline, you can write bullet points, whatever. The process of you going through those sections in this workbooks, and thank you for all of you who helped make this possible. This will help you prepare. Okay. And we mentioned bringing along documents that you have available to you to your assessment, right? Ask the assessor if they can help you get documents that you yourself can't seem to get, because they might be able to. As a psychologist, sometimes I can request for information and people will share it to me that they won't share with parents. Why that is a different topic, but sometimes it can help. Now, what's not in the workbook, however, is the stuff around you as a parent and where you struggle in parenting your child. And that's important to think through, right? Those are the things that are captured in the caregiver section of the CANS. It's important for us to know that because we need to know how to support you. Because working with children, as I said earlier, means working with their family, right? It's very rare for it to be fix the child and everything will be okay. It's very rare. It happens, but it's very rare. It's more likely that the child needs support and you need support too, so you can support your child because you're with your child way more times than any provider is, okay? Some specific notes to you all, right? And I mean this from all my years of experience. You're a support, a resource, and a very special collaborator in this process of care for your child. And it's easy to feel blamed and responsible. And it's easy to feel defensive and helpless when questions are asked of you. And those are all normal things to experience. I experienced them too when we were getting help for my son's needs, right? And I'm a psychologist, right? And that's part of the process. Really good assessors and clinicians are trained to know when they need to provide you support, give you breaks, help you through that process. That's our job, right? And as a reminder, it's okay to have different needs and strengths as a parent relative to each of your children. I mentioned this earlier. That's perfectly fine, right? And we need to understand what it is for the child that you're trying to get help for, right? What is it like for you to parent that child? Where do you need support, right? And young people benefit, their treatment benefits when we can provide you the support that you need as well. Take some time to reflect on your parenting. What's your relationship like with your child? How does your child's challenges impact your relationship with them? Right? It happens. When my child was in his worst ADD moments, right? I swear that I was going to burst the blood vessel at the top of my head because I was so angry all the time, not sometimes at him, a lot at me, a lot at the situation, just furious, right? Did that impact my relationship with my child? You bet it did, right? Not in a good way, right? What are your strengths in parenting your child? What are the areas that are harder for you with your child, right? Do you have any personal challenges that make it difficult for you to parent your child? Another way to say this, is your child triggering you? It's not uncommon. Are they triggering you? What can you do when they trigger you, right? Because the worst thing to happen is to get lost in being triggered and you're no longer parenting your child and you're no longer taking care of yourself, right? What supports do you currently have and what supports do you need? Let me pause there and see if there are any thoughts, questions, reflections on the prep part as a parent.
I'm not seeing any.
All right.
You can pop in and let you know if they come.
All right. The other thing that part of preparation is preparing your child, right? And you need to tell them there's nothing wrong with getting help, but it's really hard to do. And our culture does not getting help for mental health reasons easy. It's gotten better, right? There are a lot of actors, singers, celebrities who are open about their mental health struggles and encourage people to get help, right? But still, it's not as easy as breaking your leg and getting help for that, right? It's hard. There's stigma around mental health in our culture. right? So it's important to spend some time preparing them. And also as a parent, being ready for the roller coaster that you're going to go through with them, wanting to get help, not wanting to get help, thinking it's stupid, being mad at you that you didn't get them help sooner, all that stuff that happens around them struggling with getting help, right? Remind them that they can take time telling their story, right? They can ask for breaks also, right? They can try to be as honest as they can be, but when they don't trust the stranger they're sitting with, they're not going to say much, and that's okay. Right? The cans, actually, we recognize that gathering information is an iterative process. It takes time. The more accurate the cans is, the more likely that you and your child trust the person who is actually completing the cans. Right? The less you trust them, the less accurate that cans is going to be. And we know that, right? It's about building relationship and trusting, right? And if you think about, for a lot of the mental health issues that are more psychological and social in nature, not neurodevelopmental, right? A lot of the things that you get help for are because of relationships gone bad. So trying to tell a stranger about what's happening can be really hard. Sit with your young person and come up with a list of questions they want to ask the assessor about the process, about what happens with the information, who they talk to, why they need stuff, just whatever question they have. There's no dumb question, right? Because you want them to feel comfortable and participating in a process that is theirs, not being done to them, but being done alongside them, with them, right? It's a mutual discovery process. Some things are going to be hard for them to talk about in front of you, right? And you got to let that be and let them have that conversation. It's really important that they, and I usually bring this up when I'm assessing a young person or talking to them about therapy, right? To ask questions about what's the difference between privacy and confidentiality. It's a really important distinction between privacy, what therapists can keep private, and what they can keep confidential, because they're different. Because this will help your teens feel like they can talk in therapy if they can understand those differences. Okay. The last thing I want to talk about here before I give you some quick tips is bias, non-conscious bias. Okay. I don't want to talk about conscious bias because that's a different topic, but let's talk about non-conscious bias. Non-conscious bias is present, happens to all of us every day, all the time. And it's our tendency to think a certain categorical way, right? That operates below our consciousness, right? And it gets hardwired into our brains. Now, the worst thing that can happen in assessment with non-conscious bias is that the assessor, who may be having some non-conscious bias, is not really seeing us for who we are, and that non-conscious bias is impacting the assessment of your child. Okay, non-conscious bias impacts our mental representations of others. Let me put that in English. In other words, it can impact our perception of other people in very particular ways. Okay, so one of the ways that can happen is non-conscious bias can dehumanize the other person, right? We can perceive others as not equal, full people, right? And what that feels like to us is we're being ignored, like we don't even matter. We're not even in the room. What we say doesn't seem to be landing anywhere because we are being dehumanized. I'm talking about extremes right now, okay? And also, so the blue is what's happening with the bias, the non-conscious bias, and the orange is how it might feel like to you. Okay, another thing that happens is that our experience as a human gets devalued, right? Your experiences get negated, which makes you feel inept, right? Makes you feel like you're just an inept parent, like I suck as a parent. That's why all this stuff is happening, right? And the other thing that happens in non-conscious bias is that it can feel like you don't know what to do and you have no ability to do anything. So it takes away your agency and you feel powerless. Okay, so when you start to feel like ignored and inept and powerless, you have to wonder, is there something going on here? Is there some non-conscious bias happening? So what can I do if this is happening, right? First of all, bring in other perspectives, multiple perspectives, right? And building consensus around multiple perspectives holds everybody accountable, right? And will result in us coming to consensus, right? So that the non-conscious bias gets outweighed by everyone else's perspective. It's one thing you can do. Another thing you can do is push for transparency. Ask for questions about how the clinician is thinking. How are decisions made? How can you participate in the process? Show me the cans. Ask questions that lead to transparency around the process. Provide feedback. I'm really uncomfortable with that question you just asked me in the way you asked me. Can you ask me in a different way? Right? Provide feedback as often as you can. Okay? Trust your instincts and get some support. Talk to someone you trust, someone who's been through the process before. Tell them what happened, get their feedback, and strategize with them a way you can come back in and give feedback. Sometimes it's hard to give feedback in the moment, right? Especially when you're talking to someone who is the gatekeeper of your getting help for your child. It can be hard to give them feedback, but you have to help address what might be happening, particularly around non-conscious bias. Let me stop there and see if there are any thoughts or reflections before I go into just some quick tips before I end.
Fabulous. I would, yes, before you started this last session, or just as you did section, we got a lot of parents talking to us about their own triggering and how difficult it is to be who they feel they need to be and want to be for their children because they are getting so triggered. And then that is really affecting parent-child relationship in some ways. So I just, I mean, we have several comments to that effect. So I just wanted to share that that is how people are feeling.
Yeah, it's a super common reaction, but I didn't say that to minimize it. I say that because it's something that we all should surface and talk about, right? If there's a chance to have a conversation, if you, if your child's therapist is someone you can talk to about that, I would talk about that. If there's another family parent who is going through something similar, talk about that. Because it's real, right? If you feel like you could use, some help in just talking it with someone, a therapist of your own, that's also helpful too, right? It's inevitable that you're going to get triggered, right? What happens I'm going to talk about something that's really obvious, but bear with me, right? Children use us as their frontal lobes when they're born. Right? Children are born, their frontal lobes are not fully developed. And I'm not making a joke. It's for real, right? What does your frontal lobe do? That front part of your brain. It helps you organize, plan, and make decisions, right? Children are terrible at all of those things, right? They need to learn, and it also inhibits our behavior, right? So helps you not touch stuff you're not supposed to touch, helps you not run around when you're not supposed to run, right? So that's what our frontal lobes do. We are the frontal lobes for our children for at least their first 5 years, and they start to learn how to have more of their own executive functioning. That's what frontal lobes do, right? So kids are used, I bring that up because kids are used to putting stuff for us to figure out and give it back to them figured out, especially around emotions. So what happens is with kids, they want to know that you're right there with them. So they're going to trigger you. And if they're triggering something that, is a wound, something painful, something you may have worked through, but not fully, they're going to go there. And so it's about finding support for when you get triggered, because they're not trying to piss you off. They're trying to say, Mom, Dad, figure this out for me because I can't figure out how to do it myself. Right? That's what's happening emotionally. That's what's happening in that attachment relationship with you. So it's okay to get help, right? And you don't have to go into deep analysis to get help. You can say, hey, my son is working through, or my daughter is working through this. It's triggering me, and I need to figure out a way to help them in that moment and then get help for myself at another time. Is that helpful? Other questions or comments?
Sorry, I'm here. I just had a chat covering everything, including my mute button. We do not have any further chat at this point. I'm going to put a couple of comments on where you can continue to chat and get some further support for yourselves into the chat in just a minute.
Thank you, Ruth. All right. So as we close this session, I just want to remind you some quick tips regarding the CANs. Okay. The first thing is every person who's assessing your child should introduce the CANs, how it works, how you participate in it, what happens to the information, and what the rating scales are all about. That's standard fare in how we train people. They should be talking to you about this, right? And if you've got someone who's going down the list of items in the CANs, stop them and say, hey, I don't think you're doing this right. It's supposed to be a summary of my assessment process, so I don't understand what's happening right now. This is not helpful to me, because it's not helpful. It's completing the CANs from a paperwork perspective rather than from a helpful perspective for you and your child. Okay. If you have a copy of your child's CANs, I don't care how old it is, share it. Okay. Because that's going to provide important information that they can build their assessment on. By the way, we don't ask a question for every item on the CANs. That's just not the way it's done, right? So sometimes, right, if you get bonked in the head and you call the EMT because you're worried that, something's wrong, they're going to talk to you and they're going to ask you some questions, right? They're going to ask you how you are, who you are. Do you know what day it is? Tell me about this. They're not asking you to describe your cognitive functioning, but they're asking you because that information helps them understand your cognitive functioning. And if there's something going wrong with your brain, it's the same thing when we're doing the CANs. We don't ask questions about every item. We want to understand your story, right? And capture that as we summarize it on the CANs. If you've been through an assessment process with another provider, right? And you know this better than I do, that if you have multiple providers, Medicaid providers for different types of mental health services, you have multiple CANs. You need to ask that the first person you work with to send the cans to the next person you work with. Insist on it. Sign a release of information, right? Because that's going to help that assessment, the second assessment process or the third, fourth, or fifth, whichever number it is, to go better, to go faster. And it links to the next issue. You need to advocate for one CANS for your child, one coordinated CANS. And what that means is providers are going to need to coordinate with each other, update each other when they learn about changes that are happening so that each of their CANS is the exact same CANS. It's one kid, it's one story, it's not multiple stories of a kid, it's the same kid. We should have one CANS that they're all holding and sharing together. Right? Now, the information might come from different providers, right? It just so happened you saw, Dr. Joe Smith one day and something happened, you told him, Dr. Joe Smith should call, Miss whoever and say, hey, I just saw, the Jones family and here's what I learned. I just wanted to let you know because you might want to update your CANS. I did, here's what I did. Okay. Be prepared to talk about those places where you disagree on perspectives when you're coming to consensus around ratings on the CANS. Okay. Sometimes parents want to rate things higher because they're worried, and young people want to rate it lower. There's a way to talk about it to come to some consensus, right? So that we can figure out if support is needed. That's the goal. Let's figure out if support is needed and what intensity of support do we need right now. And finally, I said this already, ask for a copy of the completed CANS. If you're struggling to get a copy of the completed CANS, here's something you might do, and I'm happy to make this into a worksheet if you want. Something you might do as you are talking with the assessor is take a piece of paper, draw 4 quadrants on it. The top should be needs, the bottom are strengths, and identify what needs do you need to act on, those are 2s. What needs you need to act on immediately, those are 3s. What strengths are you going to use, those are the 0s and 1s. And what strengths are you going to build, those are the 2s and 3s. And just start writing stuff down so that you can track what's important. And then when you get that CANS finally, you can go back to your notes and say, hey, this doesn't match. Let's talk about this because I would never have said that was a 2 when I think it's a 3. Right? So there's ways in which you can track what's going on in your own way, right? I put down here a description that you might write. And then I also put in the CANS item, and you don't have to put the CANS item if you don't want to, or you don't know them. Just put down what you think you need to act on and what you need to act on immediately, what strengths you're going to use, and what strengths you feel need to be built. They will all map onto the CANS, and your therapist or your assessor can help you do that. All right. Other things to think about: documentation, documentation, documentation. I know you all are sick of documentation. Professionals hate it too. It's the #1 complaint they have about work is documentation. There's a lot of it. So if you can get it ahead of time and you can either complete it online or have hard copies and you can complete it ahead of time, your experience is going to be much better. Just like when you go to, change your primary care physician, same thing. Okay. You're probably going to be asked to sign some releases of information. That's really up to you. When you want them to talk to other people, ask to sign a release of information. Say, hey, I need you to talk to my son's therapist. Please give me a release so I can sign it for you so you can talk to them. Or I need you to talk to my son's teacher or whoever, right? They might ask you for some, make sure you understand why, and feel free to ask for your own because you want them to talk to people. Okay. The mental health assessment is meant to understand the whole person of your child. So they're going to ask questions about health, education, early development, questions about your health, your family history. That's all part of understanding the whole person of your child. Okay. A reminder, it's okay to ask what they're going to do with all that information. What happens to it? Hopefully they'll have a good answer, but ask, right? And if you don't want them to share certain things, tell them don't share that with, so-and-so. Let me think about that before you share that with so-and-so, right? It's okay. It's your information, remember, yours. Okay. And feel free to ask questions about the assessor, who they are, what their experience is. This is how you're going to understand whether they're in training, whether they're an intern, if they're licensed, who they're ask questions, because you want to be able to feel confident about the person who's assessing your child. Okay. And lastly, which will give us 10 minutes for some questions or reflections. When assessment works well, right? Families are key collaborators in that process. They don't feel done to, they feel helped and part of. Engagement starts to happen, right? And when you're engaged in the process, you're going to want to go further and continue, right? It's about developing motivation to keep going, because this thing called getting help is not easy. And lastly, when an assessment works, you've just established a new relationship with a new human being, right? This is it doesn't matter how long or how short you're going to work with that person, right? A good relationship will result in a good assessment, because it's about being able to trust the people you're working with to accurately and reliably share the information about who your child is, what their needs are, and what your family